We recognized that the situation had been nearly the same in the USA as in Europe. Environmental medicine is still dominated by toxicology and hygiene, and public health, of course. Their evaluation and decision over health and morbidity is wrong, so we believe. It still leans on the old scientific approach of reductionism. Due to the mono and linear causal scientific approach insisting on the dose-effect relationship, still is not able to be aware of complexity in the chronic multisystem illnesses associated to the environment. In Germany, we succeeded now in changing the scope of the official medical association. They accept the clinical environmental medicine as a new discipline worthwhile to support advanced education for physicians and underline this by an official certification in future.
Yep.
Just a moment, the question now.
Oh, that's okay.
What efforts does the AAEM work on to start a switch in common scientific approach, and by this promote clinician environmental medicine?
Well, I'd say the biggest focus so far has been education of clinicians. In terms of changing the medical school or residency education system, that has always been a goal, and I commend you for succeeding in that. That's a big step, and I expect that the interest is there now, and that this might be a good time to complete a curriculum and present it, and with the goal of educating medical students and residents in that area. So that has always been an interest of the Academy, and it still is. To date, we've primarily focused on educating physicians who have already completed their training, but yes.
Concerning a complex scientific approach for future risk assessment, what would you mention as the biggest obstacles on the way of scientifically and politically acceptance?
It's always been a bit challenging for me to understand why there isn't greater acceptance, because once you start to read the studies, the science that we do have, it's been a bit confusing. At least in my focus area, I think some of the docs in our field have not been given easy access to the useful information. So some of those barriers would, of course, come from people who have interest in not having an awareness of this. On the other hand, I would say in terms of healthcare cost burden, there would be a great interest in finding out what made somebody sick and fixing it, rather than having them remain ill for decades and, consuming vast amounts of healthcare dollars. So I think there are, like anything else, there'll be conflicting forces, and I'm confident that both the patients and the doctors are increasingly understanding the complexities of that are contributing to their health. And as I tell people, we're looking at trying to identify the underlying cause and treat that, as opposed to just treating symptoms with medications. And what will probably change this will be the patients. They will drive it. They will move towards people who can help them when they aren't helped in a different system. And so I expect that clearly is already happening, and I expect it to continue happening as long as we can help people, and we can.
How do the insurance company react if you bring some new facts or the politics?
Well, that I think different doctors have had different experiences with that, and they make their own choices. As far as The doctor visits, one of the biggest barriers is that they are time consuming. These are not going to be your 15-minute visits, or at least if they are, it will be hard to be successful. So I think that has been a barrier for some physicians, and many doctors have gone outside of the insurance system, and they found that there are patients who find it actually cost effective to go outside the insurance system, because if they can get treated and get well, then they can work, they can function again, and it works out for them. As far as the laboratory testing, the majority of those are covered by insurance because they are traditional tests that are being ordered. So that hasn't been a big challenge. The other issue is some of the compounded medications are not necessarily covered under insurance.
Did I understand you correct now? All laboratory analytic is paid by the insurance company?
I think I said most. Not all. You're correct. There are specialized tests that will not be covered, and those are discussed with patients, and they choose whether to do them or not. But a large amount of the tests are covered.